And the deltoid is commonly used in the medical industry for injections just because it's away from any major blood vessels. Now, that being said, many doctors still recommend that you use the gluteal muscle for your TRT or testosterone replacement therapy injections. But this video is just for those looking for an alternative injection site or those just interested in doing deltoid injections. So let's get right to it. Right, before we begin, let's just take a quick look at where we'll be injecting. This comes directly from the medical literature and is practiced by most doctors and nurses. So in the first graphic, you see the green triangular zone on the shoulder, which represents the injection site. And this is located between point A, the acromioclavicular joint, and point B, the deltoid tuberosity. Now, just to give you another view here, here's a picture of a nurse's dummy that has the deltoid injection site clearly demarcated. Next, let's take a quick look at the equipment you'll need, right? Now, as you can see on the screen, this is the sort of common equipment that you would use to prepare your injection. Obviously, go according to what your doctor advised you and prepared for you. But here you see the most common equipment. Then next, what you want to do is prepare your injection as required. And if you're not sure how to do that, then please just check out my guide that clearly shows you how to do this. I do cover opening the ampule or vial, drawing the medication out, and removing bubbles from the syringe. So if you're new to this and you need to see how to prepare your injection and your syringe and needle, then there's a link to that video in the description of this video. All right, let's get down to the nitty-gritty. So the injection procedure. First, locate the injection site as we discussed earlier. Then take an alcohol swab and wipe the injection site for a couple of seconds. Next, take the prepared injection and remove the safety cap, making sure not to touch the needle. Okay, next we're going to inject into the injection site. Now, before injecting, you can aspirate if you like or not. Aspiration is where you pull back on the plunger before injecting to check if you draw blood or not, right? Now, if you need a bit more information on aspiration, what it is and how it works, just see the description of this video for another video that explains aspirating clearly. And as we discussed earlier, this injection site is safe and devoid of any major blood vessels, and the medical community doesn't typically aspirate for this site anymore. So let's continue with the injection. Push down on the plunger until all the medication is out. Then remove the needle and replace the safety cap when you're done. Wipe the injection site with an alcohol pad, and it may or may not bleed a little. That all depends on your body and the injection site. And finally, don't forget to dispose of your sharp objects into a sharps bin or another appropriate container. And that's it. Congratulations, your first deltoid self-injection. Now, please remember to work with your doctor at all times where possible. And let me know how your deltoid injection went in the comment section below. And finally, if you found this video helpful, please just click the like button, and I'll see you next time.